All right, so we're back for part two um, of my journey, uh, and where I left off on the last video was talking about being your own advocate, being your own, being an advocate for yourself, for your health, for your healthcare, for your healthcare team. It is all up to you. It's all up to you and your family. So don't let just wonder. You don't have to accept a recommendation. You don't have to accept a treatment plan. You don't have to accept a doctor. If you feel like that you aren't being listened to, or if you feel like that perhaps somebody isn't as motivated as you are, perhaps, then you need to be your own best advocate. So I'm going to move on to part two of this story. Now, where we left off was I just had a bone marrow biopsy. My hematologist with the Colorado Blood Cancer Institute called me and said, hey, confirmed, yes, it is some form of blood malignancy. But in his words, and in the words he described, and I cut it off a little bit before, in his words, he said, this is a shift to the better. And what that meant to him as a healthcare professional and as a specialist is that we were going away from bone marrow transplants, going away from T-cell therapies where you spend months in the hospital, where they destroy all of your cells in your bone marrow and replace it with someone else's, or replace it with your own if they do T-cell therapies or stem cell therapies. It's very intensive and also very, frankly, very dangerous cancers that can severely shorten lives. So it was kind of like a good news, bad news, but we still didn't have a diagnosis. But he said, we'd set an appointment for the following Friday, which would give him the opportunity to, get it under a microscope, do some gene mapping, figure out exactly what they had. And he did call me. Excuse me. I went in for my appointment. This time my wife was able to go. She hadn't been able to go to the previous one. But my wife was able to go with me, sit down, because I really wanted her input also on the team and just where we were. And so we sat down, and he comes in and just very matter-of-factly, says, well, we've nailed it down, and you have something called Hairy Cell Leukemia. And then he immediately said, but he goes, it's really not a leukemia, certainly not in the classic leukemia form, but it's more lymphatic, it's more lymphoma than it is leukemia. And he used the words, and actually this is what I really appreciated about him, the first call that I got from him, where he said, hey, shift to the better, you do have cancer, we have to nail it down, find out what it is. He said, shift to the better, and that it was indolent, and indolent meaning slow growing. So for the 5-6 days between that conversation and the next appointment, I was kind of hanging on those two things, that hey, this is better, on the good side of bad, and that it's indolent, that it's slow growing. And both of those are great. At least in my book, they were great. So he sits down and says, you've got hairy cell leukemia. And he again reconfirms it's indolent, very slow growing. Says, in fact, you probably have had this for a couple of years. When you had pneumonia earlier in the year, probably the reason you couldn't get over that upper respiratory infection and why it turned into pneumonia was because you have a very compromised immune system. Now, I had a very compromised immune system despite the fact that I actually take a lot of supplements and do things that actually help immune system. I've done it ever since COVID. I take a lot of vitamin supplements, D3. I take colostrum and other things that are supposed to help with your immune system. And that may have helped me actually stay very healthy at a time when for a couple of years I had cancer. But anyway, he talked to me a lot about me being my own self-advocate and how I got there, which he thought I got there because oddly enough, I was involved in an auto pedestrian car accident, and it put me in the hospital. And the first thing I said when I went into the hospital was I got low blood platelets and my blood is all screwed up. You need to know, because at this point my legs, where I got struck by the car, everything was swelling, bruising, everything was bad. And the number one first thing they would normally do is to put you on blood thinners if you've been in a significant trauma situation, because they want to avoid blood clots. They couldn't do that with me because my blood was already very thin. But anyway, he kind of thought that's what it was, and I took him through this this pathway to self-advocacy that I was on myself, where it was me calling the doctor saying, hey, what do you think about doing follow-up tests? Let's, we never checked to make sure I went back to normal. Shouldn't we do that? And ultimately the answer was yes, we should do that. And the answer was, even though I was healthy and feeling fine, other than being struck by a car, is that I'm ill. I'm sick. I've got cancer, but I didn't have the symptoms. The normal symptoms of people who have this by the time they find it is a lot of fatigue. They may have bone pain. They have may have a lot of unexplainable muscle aches. Of course, the bruising, which I was exhibiting, but there are a lot of things that you get to where you're even less healthy than what I am today. And even though I have cancer, I mean, it's odd. And here's the thing I want to tell you also is that sometimes, at least this time for me, I didn't come in because I was sick. I was worried about something I saw on a test that I went Sherlock Holmes on and said, we need to explain this. And so I'm having a discussion with my hematologist about having hairy cell leukemia, and I don't feel sick. I mean, other than the recovery from my injuries from being struck by a car, I didn't feel sick. I feel fine, and other than again the easy bruising, but I felt fine, and I do feel fine, which I guess is good for me, because as we start these treatments, I'm in a healthy position. I'm in a good place. So he explained what hairy cell leukemia is, and I'll let you look it up online to learn more about it. But basically, it is a cancer in the bone marrow, and it causes a replication of a type of cell that doesn't allow white cells to be created. It's doing that instead of creating white blood cells, doing that instead of creating red blood cells. And those cells are dividing and replicating faster than what your white blood cells and red blood cells are. And the reason it's called hairy cell leukemia is because when you look at it under a microscope, you see the cell and it looks hairy. So that's the reason it's called that. It's a fairly rare type of cancer. According to my hematologist, it's about 600 to 800 diagnoses each year in the United States. So not very many, but again, it's very slow growing. And then we sat down and answered any questions I had about, the cancer itself, which I didn't have a lot. And I got to be honest, I didn't do a lot of research. As soon as he threw a couple of names at me the week before, despite my going to Dr. Google before, I didn't do it again. My wife did. And my wife did so that she could know what to pray that I had, which sounds kind of weird, because she was praying that if I had cancer, of course she was praying I didn't have cancer, but she was praying that if I did have cancer, that I had hairy cell leukemia, because it's treatable. And so we sat down and we looked at his recommended treatment. This was last Friday, and he said, we want to start chemo on Wednesday. Can you come in on Wednesday? I was like, you bet I can. I'll be here on Wednesday. And we're going to have to do a few things to get ready for it. My platelets are too low. They're going to put in a port up here so that they can do the chemotherapy. And I'm not going to talk about the specific types of drugs that they used. I might talk about it later. I can't even think of what they're called right now. But basically the schedule is I'm going to start on Wednesday, and I'm going to do 5 straight days of chemo. I'll go Wednesday, Thursday, Friday, Monday, Tuesday. Chemo every day. I'm going to drive to Denver every day. And get chemo as an outpatient, unless I have to be admitted. And the only reason for being admitted is if I get an infection and have a fever that spikes to more than about 101.4, I think they said. As soon as I get to 101.5, they want you in the hospital. They want to, hang antibiotics and make sure that you have 100% the best care possible, which is great. I love that they're, that they're so proactive. Everything they've done so far has been very proactive. Matter of fact, after our first meeting, he immediately put me on an antibiotic, a very strong antibiotic, once daily, just because he said, your immune system is very compromised. I do not want you getting sick. And if you get exposed, I want your immune system to have help already in your system. So he put me on, I'm going to close this window here. It's causing these curtains to blow a little bit. So give me just a second. Here, I'm just going to pause it. And now we're going to unpause. Sorry about that. He put me on antibiotics to make sure that I had help in my system should it get worse. And then, not get worse, should I get infected, should I have, anything get into my system. He wanted there to be something there already. And then they've scheduled me for leukemia on Wednesday. My appointment was last Friday with the doctor, and it was weird coming home. And that's all I want to talk about, how I felt, how I'm feeling, because if I do post this, I want people to know what I went through. Maybe it'll help you. My wife was kind of doing handstands in a way, backflips, because I had a treatable form of cancer. She'd done a lot of research into different types of cancers that I really didn't want to have. Don't want to have any of them, to be honest. But actually the doctor put it this way. He said, if in the great big grab bag of cancers, if you were to put your hand in and pull out a cancer, he goes, this is a pretty good one to pull out, because I can treat this. He goes, I can't cure it. Not today. Might be able to in the future. I can't cure it, but I can treat this. Last Friday, we're driving home from the doctor, and we're calling our kids. We have 2 grown sons, and we'd shared with them that, Dad's got cancer. We don't know what kind yet, but we had to call him back to let him know what kind it was. They're both in their early 20s, just got out of college, and live in another state, which is distressing to them because they would love to be here. And of course, we'd love to have them here. But so they got brought in. Then we called my wife's parents, called my mother, who's still alive, and let all of them know. And but generally, I felt really positive because I felt like number one, I had the right team. Every time this doctor wanted something, needed something, his staff was on it, and they had it scheduled, and it was quick. I mean, we had the answer like that. When can we get him in? When can we do this? And we had the answer, and we were going. So this Wednesday, I'll go in. They'll put in a port. They're going to give me a blood transfusion because my platelets are very low. They want to make sure that I'll be able to clot properly around the port when they put that in. And then I get the first dose of chemo on Wednesday, and we're going to do that for 5 days. And then the next treatment plan is to wait then about 4 weeks after that. And I can't recall, either they're going to do a bone marrow biopsy sometime in that 4-week span, or they'll do it after the next set of therapy, which is immunotherapy. We'll start immunotherapy a month after we conclude the chemotherapy. And with the immunotherapy, that'll go on for about 2 months, once a week. And every week I'll be going to Denver because they want to do blood draws and know where I'm at. But then once I start the immunotherapy, I'll go up once a week, and they'll do both on the same day. And that's going to be my life for the next 3 months. And if things respond the way that they respond a majority of the time with hairy cell leukemia, it means that we can put this into remission for years. And they said, it could be 6 years, could be a decade, could be 16 years until this cancer comes back. He said, but someday it will likely come back. It doesn't have to. He said, of course, people die of lots of things, and between now and when this comes back, if you die, you'll die with it. And he goes, there's a lot of people that die with this, not from it, but with it. So I feel really positive about our plan. I feel really positive about my team. I've got a wonderful wife. Having a support group is great. I've got a lot of great friends. At first, I was being kind of the standard guy thing where, I was going to have my wife bring me for the first chemotherapy, and then I asked the doctor, "Well, can I just drive myself to the other ones?" And he said, "Well, I mean, if you don't respond badly, yeah, you could." Um, and then talked to several friends, family members, and they're like, "No, no, you really shouldn't do that." And I'd forgotten a lesson I learned 20 years ago. 20 plus years ago, I had a son who was born premature in the hospital, severely premature. Actually, interestingly enough, life flighted from another state to the very same hospital that'll be treating me. Interesting. But anyway, back then, this is pre-social media. Uh, Help wasn't as available as it is today, where now, you just go on social media and post that, hey, I need a ride on Friday to go do something, to help with this, and somebody will help you. One of your friends will help you because you're tighter connected because of social media. Maybe the only good thing about social media. But back then, we'd get offers of help, and people always want to offer to help. I offer to help people all the time, but then we don't follow up, either on either side. Yes, we have offers of help. It is so hard, and I think it's maybe harder for guys than gals. I don't know. Maybe I'm wrong, to accept help. And I was visiting with my wife last night, and I said, you know what? Everybody we've talked to said, let me know if you need a ride to Denver. Let me know. I'll be there. Even if you just want somebody to sit with you during chemotherapy, let me know. I will be there. And, like with our son, we had very little help. Part of that was because we didn't know how to ask for help. We were too proud to ask for help, but we were very much in dire straits back then. We were in, months and months with a son in a hospital in another state, and the financial burdens of that, and the burdens on work and life. And we did have some good friends who helped us back home, but we never really communicated what kind of help we needed. And for a little bit there, for a few days here, I'd kind of forgotten that lesson, and I'm not going to forget it again. And so I got on the phone and started lining up rides. I got 5 trips to chemotherapy. My wife's going to do the first one. I got some friends who are going to do the ensuing ones, and you know what? It'll be good to have them there. My wife could take me on all of them, but I don't want her to take that much time away. She's a school teacher, and it would impact her kids to take that much time away. And it's just sitting in a chair, letting them flow poison into your veins. So she wants to be there for the first one. She wants to be there for all of them, but I just told her, you know what? Take the first day, come with me, and then I'll get rides to the other ones, and we'll work it out. And we got it all worked out. Got some friends that are all going to drive me up, and we're going to start chemo. So that's episode 2, of where we are. I don't really know a whole much more. They did give me a couple of pamphlets on the kind of drugs that they're going to give me for chemotherapy and for the immunotherapy. They gave me some anti-nausea medicines, which the doctor said, by the way, to use them before you get sick. Says don't try to. He goes, I know a lot of people that will gut bucket this out, and he goes, and I don't know why. He goes, I'm prescribing you help. If you don't want to be miserable, take them. If you want to gut bucket it through and be miserable, then don't take them. It's up to you. But I'm going to take them. And then he also prescribed a different antibiotic, and then also an antiviral. They had a concern about shingles and some other things possibly happening while my immune system is rebuilding itself over the coming months and really a year. It's going to be a year-long. It'd be a year-long process, hopefully, to get back to being very healthy. I think and I got to learn all the terms. MDR, which is like minimal disease registering. It's wrong. That's not it. But basically, it means very little of the disease is registering, or that they're able to detect. Maybe it's MDD. Anyway, I'm sure I'll learn all these terms, but which is another thing also is if you don't understand the terms, doctors speak a lot. The doctor I've got actually is very good at explaining stuff. If you don't understand something, ask. And if you still don't understand, then of course you can go to Google and you can, do additional research, or ask again, or ask someone else. I have members of my family that are in the medical field and are doctors, although not in this specialty. And I've already called them. Actually, I called one of them with the funky blood tests, and one of my closest relatives, and he was awesome. And he goes, "Well, you got a bone biopsy in your future." But he didn't say it in a bad way. It was just a really kind of matter of fact way you are with close friends, close family. And he goes, "We got to rule some stuff out. They're going to have to rule some stuff out, or we're going to put some rule some stuff in." In this particular case, we immediately ruled stuff in. But it was, you get these weird blood tests, and every one of them points towards that you have a cancer. There's always a chance it's not, and I hope for whoever it is out there that you don't, that it's something else better than cancer. But for hairy cell leukemia, I feel good. I feel upbeat, and I will tell you today, the anxiety came on, and it's the anxiety of the chemo, and it's just fear of the unknown. I don't know how I'm going to respond to it. My work will be great, but we're keeping this really tight, just because of the situation which I'm in, which I might reveal later within this series of why I've kept this very tight. Only my closest friends, closest coworkers know about this. And for now, and that's not me, by the way. Normally, I'm making a video right now, but I'm making a video now because I'm not putting this out on social media right now. I have family that know through social media, but that's it. The public knowledge to my greater band of friends, they don't know right now, and that's okay. There may be a time when I want more people to know, and there may be a time when I'm just coming back to say, hey, I made it through this, and I want to share this with you because there's always hope. So dealing with a little anxiety today, a little better right now. This morning I don't know what was going on, but and I'm not a person that gets anxiety ever, so that was new for me. I'm also not a depressive person, so I've approached this with a lot of humor, and I'll continue to do that and stay upbeat. I plan to get out and walk a lot. Plan to get outside and just, as much as I can get out and get sun and be active, I will. I'm not going to overdo it, but I'll probably make more videos. Probably starting on the first day of chemo. From what they tell me, I'm probably not going to have a whole lot of reaction to the first day of chemo, so we'll see how it goes from there. But anyway, I think I'll make this the end of episode 2. If I do post this and you got questions, you can always put them below. And I'll answer from my experience. I'm obviously not a medical professional. I'm a guy with cancer, but I'm a guy with treatable cancer. And I'm sure I'm going to have some good days and bad days. I've already had some good days and bad days. I've had, the bad day of we think you have cancer, to the semi-good day of, yeah, you've got cancer and we don't think it's a really bad one, to, yes, this is the exact cancer that you have. So anyway, thanks for listening to this. I may watch this back myself for my own remembrance and for my own health, of reminding myself what I've been through and where I've gone. This might be something for my family to have in the future, but anyway, I'll pull this to an end right now, and episode 3 will probably be, I'll try to do it Wednesday after that first dose of chemo, after they put in the plug, and after I have the blood transfusion. All should be pretty straightforward. Don't anticipate feeling real bad. Oh, here's the funny thing. Got to share one thing. So I'm going to pull this up a little bit here. I've got pretty good hair. Matter of fact, my family members joke and say that my hair is my superpower. But I was talking with my doctor, who is bald as a cue ball, and he looks up at me and he goes, by the way, he goes, I don't think you'll lose your hair because we're only doing 5 days. It's a lower dose with this particular treatment. I don't think you'll lose your hair. And and then he looked at me and he smiled and he goes, "You've got really good hair," because he's bald as a cue ball. and and I laughed and I said, "Yeah, yep, my hair's that's one of my superpowers." So and he goes, "Yeah, I think your humor is too." Yeah, and I said, "Yep," and that's how we're going to get through it. Well, not through the hair, but at least through the humor. So thanks everybody. Thanks for watching. Thanks for listening. And I'll talk to you after Wednesday after the first chemo.